I spent about an hour this morning trying to understand what was going on in Medicare in this new bill by Trump, the big, beautiful bill. And critics have been saying that about 10 million people, maybe more, will lose access to Medicare, which is a terrifying number. But the reality is, unfortunately, way more complex than can be summed up in just a headline. I dug in, and here is what I'm going to tell you about it. Then, as now, illegal immigrants are not going to be able to get Medicare. That's been in there for decades. Trump has not added anything new. The main mechanism for people to lose access to Medicare is actually overloading people with paperwork, with red tape, because the Congressional Budget Office correctly noted that if you ask people for constant updates on whether their income still meets the threshold to get onto Medicare, people are not going to fill out that paperwork because it's just bullshit red tape that you have to deal with, the same bullshit red tape that Republicans have been decrying in every other industry. And they're just foisting that on normal people to get them off the rolls. Now it will work. It will cut people from Medicare, it will save money, but it's not based in a principle of fairness. It's just bullshit. And I think this is what people are really upset about. There's also some work eligibility requirements that are new, is that you have to prove that you're working, but there are cutouts that make it better, especially for people with kids, if you're under a 14-year-old, blah, blah, blah. It wasn't actually the worst thing that I'd ever read in my life. But here's the main principle. I'm bearing the lead, and I'm sorry about that. It's that healthcare in America is broken, and we need to completely scrap Medicare. We need to completely scrap Medicaid, and we need to institute universal basic healthcare for every single American and eliminate bureaucracy entirely. We need to kick big pharma out and corporate healthcare out of the system and just allow people to have access to healthcare. That will save us money. That will make healthcare cheaper, will improve health outcomes. And all of this sort of argument and the bullshit over this bill is missing the main point, is that our healthcare system sucks and we need to rebuild it entirely and make it accessible to everyone.